I'd like to present our first award this evening, which is the Friend of the Field Award. Friend of the Field Award was established by the American Association for the Treatment of Opioid Dependence Board of Directors for the 1988 conference in New York. As Paul knows, he and the Legal Action Center were the very first recipients of that award. This award recognizes extraordinary contributions to the field of opioid addiction treatment by an individual whose work, although not directly related to the provision of opioid treatment services, has had a significant impact on our field. The 2015 Friend of the Field Award recipient must be approved by the Conference Awards Committee, which Ann chairs, and the entire AATOD Board of Directors. The 2015 Friend of the Field Award is being given to Governor Peter Shumlin for his extraordinary efforts in focusing on the public health crisis of opiate addiction. Governor Shumlin's career in public service began more than 30 years ago. He served 8 terms in the Vermont Senate and was elected by his colleagues to lead the Senate as President pro tem during that time. Elected governor in 2010, he recognized the reality of the rising opioid-related deaths in Vermont. In June of 2013, Governor Shumlin signed into law 2 bills aimed at reducing the toll of drug overdose deaths in the state. In 2014, Governor Shumlin decided to take a bold approach to this problem and devoted his entire State of the State address to this public health crisis. No other governor has ever done that. Since then, he has increased treatment access and funding and has a significant impact on the surrounding region. Vermont is now said to lead the country in addressing opioid overdose through broad-scale and comprehensive overdose prevention legislation. The governor is currently working with other governors in New England and elsewhere to be certain that he is doing all that he can to increase access to quality addiction treatment services. I can tell you that I've listened to this gentleman speak on a number of occasions. He's clear, he's passionate, he believes in this. He really is an extraordinary human being. I'm grateful for what you've done. I know our board is. I know our entire field is. So, ladies and gentlemen, please join me in welcoming Governor Shumlin.
Thank you, Mark. Thank you so much. Thank you so much. I am accepting this for all of you who are doing the hard work with the folks that need you desperately and the folks in America who are discriminated against as much as anyone else in this country. So thank you from the bottom of my heart for your work and your progress. We're in this one together. And you know, it's an extraordinary to see so many people in a conference room. We don't even have technology like this in Vermont, these big screen things. If Vermonters saw that, they'd think something was desperately wrong. I'd have gotten a haircut if I'd known you had this kind of technology in Georgia. I want to thank Mark for having and the board, not only for recognizing me, but Mark, I know that you helped get this association started and happening. And where'd he go? Thank you from the bottom of our heart, because it takes folks sticking together to solve a big problem. And that's what you all are doing together. And Jonathan and I had the pleasure of sitting next to your mom and dad, Rip and Lori. The acorn doesn't fall far from the tree. That's what we say in Vermont, right? What do you say in Georgia? The peanut doesn't fall far in the ground?
We like acorns too.
Acorns too. Anyway, you're a beautiful guy because you got beautiful parents. Thank you all. I really am humbled by this and encouraged to see the progress that we're finally making on a disease that desperately needs us. And, you know, I'm going to spare you a written speech. It doesn't mean I'm going to spare you a long speech. But I know in Vermont, I'll just tell you, I always like to hear know a little about the person that I'm giving an award to. I'm dyslexic. I had a terrible, terrible time learning how to read. And, you know, I was born in a state, Vermont, long enough ago so that we had no special education, no IEPs. You all were in one big classroom together. I literally never will forget being dragged into the principal's office, and I don't know if any of you learned differently, but we spent a lot of time in principal's offices. But I got dragged in one day, and I couldn't figure out why they'd called me in, because I hadn't done anything wrong yet. And I get in the office, and there's my mom and dad sitting in the principal's office. Second grade, my eyes, you know, got big as almonds and peanuts, whatever you say down here. And literally, this is how we did it in the 60s in Vermont, late 60s. The principal turned to my parents as if I wasn't sitting in a chair, and they said, "We don't know what's wrong with Peter. He's not going to go to college. He's not going to have a professional career, and we can't figure it out, but we'll do the best that we can." And then they sent me back to class. And, you know, that was a great day. And I had a teacher who several weeks came up to me, and I'll never forget this. And she said, she's passed away since, but she said, "Peter, if you'd be willing to come home with me after school, I'd like to teach you how to read. Would you be willing to do that?" And I said, "Claire, you bet I would." And she literally would, after school, load me into her Willys Jeep. She lived in a log cabin on Windmill Hill Road in Westminster, West Vermont. And, you know I'm old, but not everybody lived in log cabins when I was a kid. I want you to know that, but she and her husband did. And in the wintertime, we'd sit around the wood stove. In the summertime, we'd sit on her lawn. She took a year. She taught me how to read. And, you know, it really helps if you're a governor to be able to read. Now, I know if you look around the country, you might wonder whether some of them can, but we can and we do. But here's my point. That teacher was the light for me. She believed in me. She saw something in me that no one else saw. And that's what you're doing every single day for people all over America who've lost hope, who've lost their dignity, and who've lost their future. So when I started going around Vermont, and in a little teeny state that I'm lucky enough to govern, I probably spend more time than most governors talking to people because we don't have that many, you know, so they expect to see me. And something interesting started to happen. I'd find that at the end of the Chamber of Commerce breakfast with a couple hundred people, I'd get tugged on my jacket, and someone would look down in shame and say, "You know, I've lost my son to opiate addiction." Or I'd go to the Accountants Association. Someone would grab me and say, "You know, we've lost our mom to opiate addiction." Then I started listening to the store owners. They'd say, "You know, in the state that," and I don't want to get the rest of you mad, "but has the best quality of life in the country," which Vermont, by the way, does. You know, we really do. We take care of each other. We reach out to neighbors. We know each other. We don't lock our doors in many parts of our state. Before I became governor, and they used to let me drive, I'd leave my key in the car. The car would be there when I come back, you know. It's that kind of state. Best ice cream, best skiing, best beer, best people. And they say, "You know, our store's getting ripped off a lot," or "My car got broken into." You know, things that just didn't happen. And the one thing that we have that we cherish in our state is our quality of life. And I started thinking about it, and I started connecting the dots. I don't know anything about this field. You all do, I don't. But suddenly I realized that the one thing that could rob us of everything that's special about our state was the attitude that we were taking towards this disease. We literally were a state that was doing what the rest of America is doing. we would really, literally avert our eyes to a disease that was right in front of our eyes on our front yards. And then we would fight and fear treatment in our backyards. So I started saying, I want to know more about this. And I went into prisons. And I talked to folks that we were locking up because they had the disease. And I talked to treatment folks. And I talked to law enforcement folks and judges and healthcare providers and moms and dads of addicts. Anyone that I could get to, I talked to. And I learned what you already know. We're messing this thing up so badly that we probably couldn't be doing it any worse. It's just true. And we're losing good people and good lives. And we're turning our eyes away and hoping it goes away. And it won't. So that's the work you're doing. And that's why this award means so much to me. 5 quick things I thought we needed to change. The first was, I was talking to an addict in recovery one day. Came from a dairy farm family up in Franklin County. He's since told this story on film. And his mom came from a hardworking dairy farm family, worked on the farm, went to 10th grade. He had an exam day. He popped an Oxycontin. A friend offered it to him. He became an addict hard and fast. Spent 5 years struggling, doing all the things that you know addicts do. Ripped off his family, $20,000 worth of farm equipment. Really did all the terrible things addicts go through. And when he finally bottomed out, his mom called my folks. I got many of them here from the health department in Cross, Vermont today, healthcare providers from UVM. I hope you'll be listening to them because they're doing great work. They know a lot more about what I'm talking about than I do. But when his mom called, because he'd bottomed out, and said, my son is addicted to my folks. He needs treatment. The answer back was, we don't have any room for him. Is he suicidal? And this mom said, no, he's not suicidal. Dustin, he's my son and he's addicted. And my folks said, well, you know, we got a lot of lines. We can only take those who were suicidal right now. Well, you know, she was an industrious Vermont farm mom, and she put down the phone and went back to it 5 minutes later, and she called up and she said, I got a son, Dustin. He's addicted, and he's suicidal. And you know, 5 years later, he's been clean for 5 years. He's got a beautiful wife. He's got a beautiful baby. He's put his life back together again because his mom said that he was suicidal. So I recognized that we had to get rid of the waiting lines, and we had to do it quickly. So we did. Now, we haven't entirely succeeded because the more I open my big mouth, the more folks come out and say, hey, I can deal with this as a disease, not a crime. So we got still some lines, but we've quadrupled the number of folks we're treating because we've raised the issue. But here's the point. We've built treatment centers. We've built the hub and spoke system that I know you've heard a lot about, and I won't repeat because you get it. We've brought everybody in to the system together and said, as a community, as a state, this is a disease that will be dealt with no different than any other disease in our state, and it's making a huge difference. So the second thing I got told when I talked to the folks who were addicted was, listen, Governor, you got to understand something about this disease. If you got alcohol challenges in your family, and I do, it's nothing compared to the denial that you'll go through if you're addicted to opiates. I mean, we will lie, we will deceive, we will try, we will do whatever it takes not to face our disease. And they said, your system's all messed up. I said, what do you mean it's all messed up? They said, the moment for me was when the blue lights were flashing, when I'd bottomed out. That's when I had to face my disease. And in our system in America, at least in Vermont, before we changed it, we'd bust you, you'd bottom out, we'd wait 4 or 5 months while you wind your way through a complicated court process, and by the time you came before the judge, you were back using, you were back abusing, and we had thrown away our window of opportunity. That's what we were doing. So I started digging into it. I said to my prosecutors and to my judges, to my lawyers, prosecutors, my corrections folks, why are we doing this? Well, it turned out when I really drilled down into it, that no one wanted to take the hit if something went wrong. That was it. That was the problem. No one wanted to be the one who said, this person might kill you, send them to jail, they're dangerous. Or this person is sick and needs help, get them help. So we changed the system. We call it rapid intervention. We seize the moment of opportunity now when you're bottoming out. You bottom out in Vermont, the blue lights are flashing. We've got our law enforcement folks working together with our team to bring in a third-party assessor on the spot. They're good at this. And they'll say, yeah, this person needs treatment, or no, this person should go through the court process. The vast majority, 80, 90% of folks, you know this, they won't kill you. They won't harm you. They're going to harm themselves. They're going to kill themselves. So we say to those folks, you go into treatment, you join our hub and spoke system. We're going to give you all the wraparound services we can get to you. We know you may fail at times, but if we get you back on the road to recovery, back to work, pull your family back together, all the things you've lost, and we'll get you back as a productive member of this society, state of Vermont. You'll never have a criminal record. You'll never see a judge. We're with you in this disease, and we're going to fight it together. And that's making a difference. That's making a difference. Third, why on earth are we letting folks die in the streets when we can get rescue kits that keep them alive? I got a governor a couple of states away from me in Maine. We governors think differently. But it's the ones who struggled to learn how to read that actually read the information that would help us here. And you know, we've gotten rescue kits to everyone that will take them. We're saving hundreds and hundreds of lives. When I went to Thanksgiving to one of our food shelters, a mom grabbed me by the arm. And it wasn't the story I'd been told before we had the courage to go out on this as a state. She said, Governor, I never met you before, but you saved my son's life. You saved my son's life because he was ODing, and your EMS team kept him alive because they had the ability to do it. What the heck is wrong with us as a nation that we have folks who are suffering from disease? We can stop it right there and keep them in their life, give their life back to them, and we take it away. Let's change that as a third step of common sense approach to addiction. Fourth, we have said to our entire medical community, nurses, doctors, chiropractors, naturopaths, anyone that treats a patient, as a part of prevention, you've got to screen for addiction. You're there first. Let's not wait till we need the rescue kit. Let's get there before we need it. Let's give their lives back before they go away. It's working. As part of our training and our experience in primary and preventative care, our whole team is in there getting the signs, talking to the patients, getting them into treatment if necessary, doing the things that we know would prevent the kind of challenges that we're all facing together. So that's 5 and 4 and 5, and finally, local, state, and federal partnerships, because we're in this one together. I often get asked the question, well, Governor, how come Vermont? I'm like, who are you kidding? No, how come Vermont? How come you got this problem in Vermont? The press, the national press loves to ask me that question. I'm like, really? Seriously? How come Vermont? We do have some challenges. You can buy a bag of heroin for $5, 2.5 hours on the interstate from my borders. You can buy a bag of heroin for $5 an hour up the interstate from my borders. You can sell it for $20 to $30 in a small rural state. Now, I don't know how many of you run businesses. I'm a business person. I'm on loan to government. But I've never gotten a return like that on my investment. So sure, small rural states have some challenges. But here's the point. Anybody who thinks it's them, not us, hasn't opened their eyes to this disease. So this has got to be local communities and state partnerships and the federal government changing some things that we're doing wrong. Well, what are they? The ones I just ticked off? I think those are obvious choices for us all. What else? Well, for God's sake, how'd we get into this mess? What my folks tell me when I go and ask them who are addicted is 9 times out of 10 they'll tell me they started with FDA-approved drugs. Hey, let's get down to it. They started with FDA-approved drugs. 15 years ago, whenever it was, when we started passing OxyContin out with what only can be described as, by Alan Greenspan, if he were here, as irrational exuberance. Seriously. We prescribed enough OxyContin, as I understand it, the second year it was on the market in America, to keep everyone over 18 in America high for a month. I mean, come on. And it was crushable, and it was snortable. So then we made it tamper-resistant. Well, get this. I know you all know this, but this blows my mind. The FDA's got that advisory crew, good folks, docs and others, that make judgments about what to approve and what not to approve. So they voted, I think it was 11-3, not to approve Zohydro. I'm sorry if there's any manufacturers here of Zohydro. I want to apologize to you in advance. But listen, that stuff is OxyContin on steroids. And you can shoot it, and you can snort it. So really? That's next? I can tell you without a shade of doubt in my mind that painkillers prescribed by medical practitioners create heroin addicts all over America. Let's talk about it. Why are we so hesitant to talk about it? When we talk about something, we solve something. So we've brought together the governors in New England, the Northeast. Maine didn't show up, but everyone else did. And guess what? We're making it really hard to prescribe the next generation of drugs that got us into this mess. So my point is, let's be smart. Let's do this smarter. Let's not keep repeating the challenges of the past. Second, insurance coverage. Why? Why is this the one disease where we say no? I was lucky to be part of mental health parity fight in Vermont 25 years ago. Why not opiate addiction parity? Why not? Insurance coverage should cover treatment for disease. I lost my dad in April to cancer. He was a great man, and I miss him every day. When he got diagnosed with cancer, for any of you that have had the unfortunate experience about going through cancer with a loved one, the first thing that the doctors tell you, or one of them, is this is an inherited disease, or this is a disease that's a result of behavior, because they want you to know whether you're going to likely have the gene for it or not. So my dad had a cancer that was a result of his behavior. You know, he was almost 90, and back in those days, they didn't know much about tobacco, and he was a smoker. He smoked cigars, he smoked pipes, he smoked anything, you know, all those good things. So anyway, the insurance company, the community, his loved ones, we didn't say, hey, Dad, you know, you made some pretty dumb choices in your life. So, you know, this cancer thing, you know, line up. You're on your own. I mean, get in line. You know, they might push you to the front of the line if you tell them that you're really bummed out about this thing, you're suicidal. Or we don't do that. So why is it that we treat this disease any differently than any other disease? So I just want to close by saying this. Fear is the biggest obstacle to progress. Fear, in my experience, is the biggest obstacle to needed change. And our challenge together is that in order to change the things that I'm talking about now, insurance reimbursements, attitudes, resources, dollars to make the difference, we need politicians who are willing to take some risk. Because, you know, something will go wrong. When I made this an issue that I felt was central to maintaining our quality of life, you know, not everybody was clapping. We all have a stigma against this disease. We do. And my point is simple. The most important thing that we can do together, why I'm so honored to be here with you, is that we in this room have the power together to bury the stigma once and for all and make this disease at parity with every other disease that's killing and threatening Americans. Thank you so much.
Governor, you are a great, inspiring